Next slide, please. Next, I want to talk about some of the regional differences that we're seeing in hospital utilization, hospitalization rates. This particular figure is showing you ICU beds in use in Colorado. It's shown on the left, and in the northeast part on the right. Throughout the pandemic, we have seen differences in community rates at different times. We know that different communities have been hit with higher rates at different times. And in the last couple of weeks, we've seen that northern Colorado in particular has had some higher rates of COVID-19, especially when it comes to hospitalizations, and as shown in this figure, ICU bed utilization. So if you look at this figure, you'll see 85% ICU bed utilization in the state right now. So overall, reasonable capacity for ICU beds in the state. But if you look at the trends in northeast Colorado, that number is 94% of occupied ICU beds in that part of the state right now. So again, some variability in what we're seeing as far as utilization of ICUs across the state. And if you go to the next slide, you'll see that that tracks closely with some of the rates that we're seeing in different parts of the state. So this figure is showing you average daily hospitalization rates, hospital admissions in Weld County compared to Larimer County, and then green comparing the rest of Colorado to those two counties. And so what you see here is that while Colorado's rates have started to go down, we do see that Larimer County's rates continue to be slightly elevated above the state rate, but Weld County's rates are significantly higher and have been quite a bit higher for many weeks recently. So again, we are seeing some higher rates in the northern part of the state. I mentioned Wyoming earlier in the presentation, and I brought that up here. I want to bring that up here to talk about the fact that we know that Wyoming residents can also potentially be hospitalized in northern Colorado. That's a common practice. We know that that does occur, and so that certainly could be part of what we're seeing right now is the admission of Wyoming residents in Colorado right now in some of those northern Colorado hospitals. Next slide, please. Finally, I want to talk a little bit about this correlation that we continue to see between county-level hospitalization rates and vaccination rates. So this figure shows you on the y-axis or left-sided axis the 14-day hospitalization rate of individual counties. And then along the x-axis or along the bottom, you see the share of the eligible population in each of those counties that has been immunized. And we see this correlation, and it's been a correlation that we've seen for many months now, where our counties that tend to have the highest hospitalization rates, shown here, Weld or Pueblo County or El Paso County, tend to be our counties where we see the lowest vaccination rates. Conversely, if you look at Boulder or Denver County, those are some of our counties where we really see our highest immunization rates, and those are the counties where we're seeing the lowest hospitalization rates right now. So overall message here is that at the individual level, vaccine is certainly going to protect you from being hospitalized, and at the population level, vaccine is really going to protect our healthcare capacity. With that, I'll hand it back to the governor.
Thank you for the update, Dr. Hurley. I also want to take a moment to thank our healthcare workers, our county public health officials, research scientists at pharmaceutical companies, the CDC, the NIH, the FDA, really everybody who has worked so hard to help end this pandemic. And on that note, there's a lot of progress being made on the approval around boosters, which is a third dose of the vaccine. The FDA took an important step forward with their advisory committee voting unanimously last Friday for the vaccine booster, a third dose to be available for people 65 and up, as well as everybody in frontline essential jobs where they encounter others, healthcare workers, teachers, et cetera. After 6 months, and this is just the Pfizer vaccine in this case, there are boosters available for Moderna as well. I'll get into that. There's some new data out today on Johnson & Johnson. But with regard to the Pfizer vaccine, the recommendation from the advisory group after 6 months, 65 and up, frontline essential workers, that tracks very well with who actually got the vaccine in Colorado 6 months ago. We were 1A, 1B at that point. It was frontline workers 70 and up, and people 70 and up. So that's who got it at that time, health workers. So the people who got it 6 months ago and are due should get that third Pfizer booster. We expect that decision to be finalized this week by the FDA. We'll obviously look at their exact wording around that, but we expect that it will cover essentially everyone who was eligible to receive the vaccine 6 months ago in Colorado. And we are ready to administer the vaccines. In fact, there are booster vaccines being administered today, and this applies to both Moderna and to Pfizer. A third dose is available for those who have weakened immune conditions, and that is self-attested. My 77-year-old parents got the Moderna booster, and we're really thrilled they did. And it's a very simple form. This is the vaccine screening and administration form. If you go to one of our sites, and we have several sites that offer the boosters or the first or second dose now, there's a simple question, number 13. Do you or your child, this is if parents are answering it for a child, but there really aren't any children who got it 6 months ago. That was much more recent. So in this case, do you have a weakened immune system or have a solid organ transplant? And so you simply answer yes if you have a weakened immune system. By very nature of this virus, people in their 70s and 80s, 90s in general have a weakened immune system with regard to COVID-19. And can honestly answer that question. Yes, it is self-attested. You do not need a doctor's note. You do not need to visit a doctor. There's nobody that needs to come between you and your booster vaccine. If you go to one of the sites, you simply answer, in addition to these other questions that are unrelated to the booster, which you answer for the first or second, you can answer yes if you have a weakened immune system and receive that. And again, a lot of the data is around 6 months after the second dose, but there's no magic to that. It could be 5 months, 7 months, maybe 4.5 months. I know of people who were planning on traveling overseas, wanted to get their booster a couple weeks before they left. All of those are good, sound, rational decisions. I have not received my Moderna booster. I plan to at some point, probably after the FDA completes the work around Moderna. My 77-year-old parents have, and I strongly supported them in that decision. And I would particularly encourage people that are older and therefore have weakened immune systems, or are any age and have weakened immune systems inherently, from getting the booster vaccine. The data looks terrific on it in terms of increased immune response. And I'm proud that we are at the same time working on getting the booster out, also continuing to work to get those first and second doses out, because we know that the level of protection you get from the 2-dose regime is a bigger change for people and a bigger hospital reduction rate than that extra protection you get from the booster. There was some data out today on Pfizer. There's still no advisory from the FDA on Pfizer. I do know of people who received the Pfizer vaccine who are going back in for Moderna or Pfizer. I'm sorry, this is Johnson & Johnson. Let me start again. There's no definitive word from the FDA on people that got the 1-dose Johnson & Johnson vaccine, how they should proceed. Initial data today shows potential for a 2-course Johnson & Johnson vaccine. I know there are other people that have begun their course of Moderna or Pfizer as a result of the substantial protection but lower protection level from the Johnson & Johnson vaccine. We have enough vaccine. The Biden administration has already donated more than 100 million doses around the world, more to go. We can walk and chew gum at the same time. We can get boosters to everybody who wants them at the same time that we can administer first and second doses and donate even more doses overseas to help end the pandemic. Just over 2% of adults in Colorado have gotten their booster dose already, including my 77-year-old parents. We want to end this pandemic as soon as possible. That means ensuring that more and more people are fully protected, can stay protected, and of course begin the protection clock for those who haven't had a chance to get vaccinated yet, and I encourage them to do so with a high level of prevalence of COVID in the community. It's an important time to protect yourself. And we're making it easier to do so. We're setting up some drive-through vaccination sites. As Dr. Hurley indicated, we have one of the lowest COVID rates in the country. That's a direct result of us having a higher vaccination rate. Many companies are taking additional steps to make sure their employees are vaccinated. Raytheon, which has a major presence in Colorado, announced that their workforce would be fully vaccinated. So have Aero Electronics and Tyson Foods and Northwestern Mutual and Banano Concepts, Vail Resorts in A Basin. That's just a few. There's so many. Colorado is launching 4 community vaccination sites. Each one will be able to give up to 1,000 a day, and if we reach that capacity, we will look into expanding that capacity. And these locations include Aurora at the 15151 East Alameda Parkway. That's the Aurora Municipal Center. That's open 9 a.m. to 7 p.m. Littleton at the Southwest Plaza Mall. Drive-through, 8501 West Bowles Avenue. In Colorado Springs, 1710 Briargate Boulevard. It's a walk-in clinic, 10 a.m. to 5:30, and then another walk-in clinic in Commerce City at Dick's Sporting Goods. So we have 2 walk-in, 2 drive-in, just to make it even easier, even quicker. It's also available at your local pharmacy, your local doctor's office, your local clinic, and your local hospital. I heard from a friend of mine today. Her 96-year-old grandson called, taking her to a clinic for him and her to get the vaccine. He was immunocompromised, and initially they offered him the vaccine and didn't want to give his 96-year-old grandmother the vaccine. But and I apologize that they are still, for the next few days, we're working to overcome those barriers. Everybody who wants the booster should be able to get it. He was able to then have her check the right box that she has a weakened immune system, which 96-year-olds do. She got the booster. But that still is happening out there, and I get that. But we have tried to make the form as simple as possible for you to get the booster if you want it. It simply says, do you have a weakened immune system or have a solid organ transplant? That part's straightforward. But if you have a weakened immune system, you simply check it. And vis-a-vis the virus, particular to the virus, yes, people in their 70s, 80s, and 90s, by nature of their age, unfortunately have a weakened immune system. That's why a disproportionate number of the hospitalizations and fatalities are among older Americans. But as you know, this virus can take people from us in their prime as well, which is an important reason for people of all ages to get vaccinated, especially with those first 2 highly effective doses. And we really can't end this pandemic alone. We need to come together as Coloradans to get protected and put it behind us. And I really applaud every Coloradan who's done the right thing to protect themselves and their family, who's gotten vaccinated, who wears a mask when they're around others to further decrease transmission. And to those who remain unvaccinated, you can do this. I know you can. It's something being asked of you. I understand it is a deeply personal decision. And when you weigh the pros and cons and you look at it objectively, you'll see that it's not even close. The benefits are tens of thousands to 1 of getting this vaccine. But in addition to protecting yourself, and I know no one's going to care about you and your family more than yourself, and I know you want to protect yourself, but in addition to that, you can know that you are doing your part to end the pandemic, which means saving the lives of people whose faces you may never see, that you may never know. And the simple step to do that is to get vaccinated. Let's all do our part. Let's move us forward. Let's end the pandemic. With that, we'll take some questions.
Hello, this is Meg Wingeter from the Denver Post. Can you hear me?
Yes.
Okay, this question is more for Dr. Herlihy. You said about that things appear to be trending in the right direction, but it sounds like there's kind of an uncertain period of which way it's going to continue to go. Could you expand a little bit on what people what they should know about the uncertainty at this point?
Yes, great question. And so what we are seeing in the data right now, as I mentioned, are numbers that are up and down. Some of that I think does have to do with the Labor Day holiday. We know that there are reporting aberrations that occur around holidays. And so because of that, the numbers have been up and down. Overall, it looks like we are seeing a gradual decline to a plateau at this point. When we see numbers that look like a plateau, we often call it an unstable equilibrium, meaning that numbers want to go up or go down. We rarely stay at a plateau for very long. And so what we are looking for right now in the data is really signs that these trends are going to continue to go down versus trends could potentially go back up again. And what makes me nervous about this time of year is that fall is a transition time. We move indoors, the weather gets cooler. Certainly the last 2 days have reminded us about changes in the weather and how that changes our activities. And so there is that possibility that we could be looking at a potential increase in cases once again. And so I think it's important for us to continue doing the things we have been doing. Masks continue to be important. Social distancing continues to be important. And of course, ultimately getting the vaccine continues to be incredibly important. So as we move into the fall, it's tough to know exactly what our trends are going to do, but we're going to be watching the data carefully and of course, continuing to recommend all of the precautions.
Hi, Governor. This is Brandon with Fox 21 News in Colorado Springs. I got 2 questions, if I might. The first, From Otero County, the commissioners down there are worried about their hospital staffing in regards to the vaccination requirement, and they're asking for an exemption from that requirement because they're worried about being able to treat people in that area. Is that something you're willing to do, or what? How do you weigh those two vaccination rates and the staffing issues?
Well, first, the vast majority, overwhelming majority of frontline healthcare workers and doctors and nurses are begging their fellow Coloradans to get vaccinated. They were among the very first protected. The vaccination rate for doctors is over 96%. If the rest of the population was as well vaccinated as doctors, there would be no pandemic. This would be over, period. And so there's generally been great support from healthcare workers who are worried that a few of their colleagues, very few, might remain contagious and unvaccinated. We want to end this pandemic as quickly as possible. Now, under President Biden's executive order, any facility that accepts Medicare and Medicaid reimbursement, which are major insurance coverers, need to implement that vaccination requirement. So any hospital that is not implementing that or has workers that are not protecting themselves is at risk of losing some of their funding under Medicare and Medicaid. The reason that this applies to people in hospitals is the people that they're around have no choice but to be around them, right? If you have a heart attack, a stroke, you have no choice but to go to the hospital, and there's a almost custodial relationship that those folks have with you. And the last thing we want is those who are already medically vulnerable and have to be admitted to hospital for another reason have an additional risk of contracting COVID while they're being hospitalized.
One was after Pfizer's announcement yesterday in regards to kids 5 to 11, you said that the FDA should work through their weekend, cancel the weekend plans in regards to moving that data forward and processing it. So have you been frustrated with the FDA over the course of this pandemic, and why are you calling on them to work through the weekends?
Well, first of all, this pandemic has been hard, and everybody that works in public health, our county public health officials, many of whom have gotten threats and had a very difficult time, the CDC, the FDA, the NIH, our state team, including Dr. Rachel Hurley and her team, everybody who works in public health. It's the worst of times, and in some ways, the most important of times for them and their work. And I want to, thank the FDA for understanding that we are in a pandemic and that they need to move quicker than usual. That was exactly what my remarks were. They have the data now. The data is being presented on the 5 to 11-year-old plan, which is 1/3 of the Pfizer dose and shows a very robust immune response. They need to review that data expeditiously, meaning look through it, schedule the meetings quicker. A difference of a few weeks can save lives. So we are hopeful that that will occur in late September, early October, that approval will occur. And we know that not only are 8 kids under 12 hospitalized today, but that is also a major way that the virus continues to spread in our state because the much lower level of protection for kids. So right now, parents of those 12 and up, please get your kids vaccinated. It's available now. It's a great step to take. There is no need for your 12 and up year old to be vaccinated, to be hospitalized. If they are vaccinated, they won't need to be hospitalized. If they are 11 and under, we are hopeful that news will be delivered soon and that they will act expeditiously and not unnecessarily delay the review of that very important data about the protection that can be given to 5 to 11-year-olds.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado. Gobernador, en español, siguen aumentando los casos de COVID-19 en el estado y ya casi no hay camas en los centros de cuidados intensivos. ¿Cuál es su estrategia para controlar la propagación de este virus?
Tenemos camas disponibles, 204 exactamente. Hay regiones en el estado, especialmente el norte de nuestro estado, donde están viendo más casos de personas que están hospitalizadas porque menos personas son vacunadas. Es muy importante hoy para todas las personas continúen utilizando tapabocas entre edificios, cerca de otra gente y más importante, se vacunen para terminar la pandemia.
Governor Chris Vanderveen with 9 News. The state's own website is suggesting that there is a growing issue with staffing in the state's hospitals, now to the point where 1 in 4 hospitals are anticipating a staffing shortage. And it's gotten to the point where some hospitals are begging for options here. There's a letter from the Arkansas Valley Regional Medical Center that says they used to be able to hire contract nurses at $80 an hour, and now it's $140 an hour to get a contract nurse in. And they're anticipating even more labor shortages with the mandates coming up and those deadlines. Two questions. One, do you believe that we're facing a problem with a labor shortage? And if so, what can the state do to try to address that?
This has been a grueling year for people in healthcare, and I want to thank our nurses, our hospital workers, our doctors. They've been called upon time and time again in the initial phases of the virus at risk to themselves of contracting the virus. They were then among the very first that were vaccinated. Even so, being called to work additional shifts and overtime. I've heard from nurses that came out of retirement to help with vaccination clinics and help on hospital wards. And it's, simply a function of human nature that many people who work in the field are burning out or have burnt out. And to those who are working in our hospitals, I want to encourage you to stick with it. And also to say on behalf of a grateful state of Colorado, thank you. I know this is tough on you. The pandemic's tough on everybody in different ways, but a special thanks to our healthcare workers who are still facing overcrowded hospitalization wards, ICU beds. And I know it's also frustrating, especially now, for many of our nurses and hospital workers because they know that this level of hospitalizations is not necessary if people simply made the decision to get vaccinated. It was one thing when it was a crisis of everybody and they knew they were doing what we can and putting their personal lives aside to help. Now, in many ways, it's harder to get into that service mentality because those that are working on the wards and in the ICUs know that it's simply unnecessary. And if people took the very simple step of getting vaccinated, not only would they have their own lives healthy and secure, but you wouldn't be called upon to miss your kid's soccer game and dinner, miss a night's sleep, and have to work several shifts in a row in a difficult ward. Yes, the state absolutely can help. We're exploring ways to help address this shortage. We're exploring short, medium, and long-term ways. So this is not just a short-term problem. We have a medical workforce problem with an aging population even outside of the COVID-19 pandemic. That's why we want to create more pathways through workforce development for people to be able to become nurses, nurse techs, work in varying healthcare degrees. It's one of the areas that the state legislature and us is examining for the approximately $200 million one-time investment in workforce development is making sure that we can shore up our healthcare workforce.
Governor, this is Gabrielle from Fox 31. Just a quick question for you about testing. You mentioned the 2 million Binax at-home tests. Is that enough to meet demand? Is this something that the state will be continuing to order sort of on a rolling basis? And how is the state handling testing for state workers who opted not to get vaccinated?
Yeah, so at different times in the pandemic, we've had greater demand for tests than supply, and there's been other times we have greater supply than demand. And we always seem like we're chasing where it was. Right now, I'll give you an example. In the schools, we have more supply than demand. We want more kids to sign up for weekly testing. We want more schools and school districts to get implemented weekly testing. We're even paying kids $10 a week to be part of the weekly testing program. So we have far more testing capacity than demand in the schools. Now, this at-home program, we'll see. We want to get the tests out. If we go through these tests in 3, 4, 5 weeks, we will absolutely look into seeing how we might be able to continue the Binax at Home program. Right now, I'm just excited to get demand going because I know that if these tests are in the field being used, people are getting results back, isolating earlier, spreading the virus less, it will save lives and help end the pandemic in Colorado. What was your second question? Gabrielle?
Okay, can you hear me?
Yes, well, I think you had a second question too. What was your second question?
Yes. Yep, the second question was about how the state is testing state workers who opted not to get vaccinated.
Yeah, so I have some initial statistics on that to report out, just as Denver reported out for its workers. About 25,853 state workers either have to be vaccinated or get tested. Over 20,274, just about 80%, have demonstrated that they are vaccinated. The number is probably higher. There's still some that will be coming in. The rest will be testing, and that is being handled by each department in terms of how and where they do that of the state. So we have state workers all over the state of Colorado from Pueblo to Grand Junction to Denver. There will be a way that they can get tested to make sure that their coworkers will be safe. And although I personally disagree with their decision not to get vaccinated, we do respect that decision.
Hi, Governor. John Daly, Colorado Public Radio. Thanks for taking our questions. Question on vaccines for the 5 to 11-year-olds.
Yeah.
Do you have a sense, both of timing and also would those shots be delivered through schools mostly or through pediatricians?
Yeah.
And then do you expect requirements for schools and sports leagues, things like that?
Yeah, you got a few questions there. So FDA has the data, act expeditiously. We hope in October it will get approval. And, I think the worst case scenario is they consider it in November. Obviously, this is all subject to their successful review of the data and the safety and efficacy, but assuming that is there, it doesn't change if you sit on it, so please review it expeditiously, make the decision. We hope that is in October. They will be available everywhere. Well, not everywhere adults can get their dose because it is 1/3 the dose, but most of the locations where adults can get a dose will also have the child's dose. This is important to note. It is a different dose. 12 and up is the adult dose, but the dose that Pfizer submitted the data on for 5 to 11 is a smaller dose. These are smaller people, so it makes sense, but they tested different doses. They tested the adult dose, different fractions of the adult dose. They found that the smaller dose is sufficient to invoke the immune response, and that is likely to be what the FDA asks on. So you're going to want to check with your local pharmacy, your local doctor, do you also have the children's dose for under 12 once that's approved? It will be available at the state vaccination sites, and of course, pediatricians' offices. We're making an extra effort to enroll family practices and pediatricians. We talked about that a couple weeks ago. Many of them had not been involved in the early rollout, in part because they see predominantly kids. We have now made a major effort, including incentives to help cover any costs they have of being able to administer the vaccine, and we hope that many more of those pediatricians are online. So it will be the same way that adults get it. Parents will go with their kids, pharmacy, clinic, hospital, vaccination site, but you will want to check to make sure, again, once those vaccines are approved for 5 to 11, we hope in October, that they also have at that location the child's dose.
Governor, hi, John Frank here. Can you hear me?
Yes, go ahead. Speak a little closer to the mic, but go ahead.
Yes, thank you. I want to double back to those numbers on state employee vaccinations. That's a pretty significantly low number. I'm doing the math as we speak right now, but 13% or so. Is that an indication that your mandate is not working, and what plans do you have to increase those numbers?
Well, no,
Thank you.
that's a higher number than the general population. So we were excited about that. We didn't know if it would be a higher number than the general population. It is. And there is not a mandate for state workers. They can either get vaccinated or be tested. And there are some state workers that have a custodial relationship with others, like our prison guards, who actually are vaccinated and tested. It's both. And so there are some that we take that extra step to do. But no, again, I think the number will continue to go up as people who just haven't got around to it show that they were in fact vaccinated. But I was pleasantly surprised to find that the vaccination rate for state employees was quite a bit above the state average. 78%. So, and the state is at 76%, I believe. So we're about 2% above the state average. But it will be higher. That's not everybody. This is preliminary data. There are other state employees who will be showing that they are vaccinated. I fully expect it'll go up a few percentage points more. Oh, one more thing.
Hi.
Let me on the state work. So if they don't want to be tested, they would need to be vaccinated within the next week or so. So some are planning to get vaccinated, or were vaccinated yesterday, today, tomorrow. We wouldn't have those in. Next question. Go ahead.
Hi, it's Lauren Gardner from Politico. Can you hear me?
Yes, go ahead.
Hi. Has the Biden administration communicated whether there will be an increased allocation of COVID vaccines to states once a booster plan has been approved by FDA and CDC? And if so, what would that look like for Colorado? And if they haven't, what does the state need for the federal government to meet the anticipated demand?
So they have not yet, and we have enough dosage now to move forward with our nursing home vaccination program, which is the most important folks to protect for a couple reasons. Residential living, mostly 70s and 80s, all Pfizer recipients, because they were the very first to be vaccinated, and Pfizer was the first vaccine available, and the booster is most important for the folks who got the Pfizer vaccine. So we are moving forward with a full plan to vaccinate all nursing home residents over the coming 3 weeks with the booster dose. I hope that we have the level of interest in the booster that the issue we're facing is that we need more vaccines. That's simply not where we are today. We have plenty of vaccines, Pfizer and Moderna, to make the booster available for everybody who says that they have a weak immune system or that otherwise meets the criteria that the FDA lays out. Hello? Thank you, Colorado. Stay safe, get protected. Let's end this pandemic. Thank you.